We spend a lot of time, as the writing group, to review all the new evidence that has come out in the last few years on how to treat chronic lymphocytic leukemia with targeted agents. So the guidelines are really focusing on the management of CLL and the therapeutic options. Primarily the differences are, as you might imagine, in patients with relapsed refractory CLL, where ibrutinib or idelalisib and rituximab combinations are now standard of care in the NHS, and they're NICE approved. We've also carefully looked at the real-world evidence on what treatment options should be available for patients following on from relapse after ibrutinib and idelalisib or idelalisib and rituximab, and we recommend that venetoclax is the treatment of choice in this setting, and venetoclax is approved by the Cancer Drug Fund. Clearly patients with TP53 disruptions are a particularly challenging group of patients, and the guidelines will recommend the use in the frontline setting in patients with TP53 disruption of either ibrutinib or idelalisib and rituximab. And again, venetoclax is mentioned as a choice for patients who for reasons of comorbidities or drug interactions are not eligible for those BCRI treatments, then those patients can have venetoclax instead.